friends, happy Friends of Franz Tuesday. How are you guys? The weather has been beautiful the past weekend here in New York City. It was in the 60s degrees Fahrenheit, and to our listeners outside of the US, that's about 16 to 18 degrees Celsius. I know, the US is so weird using every unit is different from the rest of the world. But yes, we just had daylight saving time and the sunlight is still out when I get out of work. Seasonal affective disorder is hopefully calming down for many. And the past month or two, it's been tough here in New York with the cold weather and snowstorms. But spring is in sight, baby. And that also means one thing. The season is coming close to its end. Where did time go? We're on the 5th to last episode of the season and I cannot believe it. We've gone through a journey with this 4th season, from ancient Eastern medicine and practices, to more modern science health topics, and to more system-focused conversations. It's been such a joy, and I'm just so grateful to everyone who's still sticking on to this season. Okay, I don't want to make the episode intro too long because I'm so excited, and worried, honestly, about you listening to our topics today. Well, I guess it's more of a quote-unquote sensitive and vulnerable topic. But it's really nothing to be scared of. It's something we all go through. And the reason I actually thought of talking about this topic, years ago, I just couldn't find the perfect expert guest to have on, was because of an experience I had with a friend a few years back. Obviously, I won't name who, but I met up with a friend for lunchtime in K-Town after they just had their hemorrhoid procedure. I can tell they were also so wary of telling me, despite me being a nurse and seeing it all. I was coming from a flu shot gig, had my huge bag with all my supplies, we were having good food, and then when we were getting ready to leave, my friend stood up from their chair and their facial expression completely changed. Terrorized, aghast. They noticed a little bleeding from the procedural site in their pants, which seeped through and onto the chair. Good thing the chair had a plastic covering, so the blood just remained on the surface. It was also a good thing I had my flu shot bag, got some gauze, and helped them clean it up right away. I could tell that my friend was so embarrassed, and this is true for many of our experiences when it comes to our more sensitive parts of the body, like the workings of our stomach and our bottom end, or our butt. It's so ridden with shame and stigma when it comes to topics like constipation, diarrhea, hemorrhoids, anal fissures, you name it. Well, finally, after many years, I finally found the perfect expert guest for us today to help us tackle all of these topics, how to really help alleviate or fix them, and how to structure conversations so we can rid these topics of their attributed shame and stigma. I am actually a huge fan of our guest today. After I had my appendectomy back in 2022, I had severe constipation after the procedure. I was in agony and excruciating pain, and I was looking for every way possible to alleviate it. I stumbled upon a colon and rectal surgeon on YouTube with a screen name Your Friendly Proctologist, who had videos on all things constipation, fiber, hemorrhoids, anal issues, and all of those sort. He spoke of these topics with so much empathy and kindness and grace. I knew I had to get him on the podcast someday, and he's finally here. Wow. I am so honored. I am so humbled to introduce to you Dr. Albert Chung from Rancho Santa Margarita, California, a double board-certified general and colorectal surgeon and known online as Your Friendly Proctologist with over 200,000 subscribers in YouTube. Featured on Time magazine, Dr. Chung really is the go-to for all topics about the bottom end, and I am so honored to have him on. Okay, let's get to the bottom of it. Do you get red after a sip of alcohol? Well, I do, and it actually has a name, the alcohol flush reaction. And in my case, the infamous Asian glow. But something I didn't realize is that Asian glow isn't just a cosmetic issue, it's a real health risk, linked to increased cancer risk and poor alcohol metabolism. Thankfully, Join is here to help. An AAPI and woman-founded supplement brand that was created to be the most effective natural solution to support people with alcohol flush and recovery, while boosting overall health. Made with clinically studied, all-natural ingredients like glutathione, milk thistle, and B vitamins, you can now finally feel confident when you drink. Get 20% off your first order at jointhefun.com. That's JOYNTHEFUN.com with the code FRANZ. That's FRANZ. Let's give the Asian glow a different meaning. There are trips, and then there are experiences. Imagine a journey where beauty meets meaning. Your K-Beauty Tour is a 7-day privately curated immersion in South Korea, blending Korean skincare expertise, holistic wellness, and cultural depth, from the trend-setting beauty districts of Seoul to the serene beaches of Busan. Personally hosted by leading beauty and wellness content creator and my dear friend, Daniel O, this experience offers access you simply cannot get on your own. From palace courtyards where empresses once prepared their skin with hand-ground herbs, to private aesthetic consultations, bespoke color analysis, exclusive spa therapies, and blue ribbon level dining. With intentionally limited spaces for May 10 to 16, 2026, this is beauty elevated to ritual, where skincare becomes ceremony and travel becomes something unforgettable. Visit yourkbeautytour.com to learn more and reserve your place. Hi everyone, welcome to another episode of the Friends of Franz podcast. Today I am so excited to introduce our next expert guest. Oh my gosh, you guys notice I don't really fanboy that often, but today I am just fanboying so hard. I first stumbled upon his YouTube videos 3 years ago after that horrendous appendectomy that you guys know about, and now he's here in front of us, Dr. Albert Chung. Thank you so much for joining me.
You're so enthusiastic. I freaking love it. Yeah, it's great to be here. Thank you so much for watching my videos, but thank you for inviting me. This is amazing. I love your personality, Christian.
Thank you so much. I love this. I love how we're starting out. Well, Dr. Chung, can you introduce yourself to my audience?
Oh, I would love to. Thank you. You've done such a great job. I'm a proctologist in Southern California in Orange County, and I'm a colon and rectal surgeon. That's the more modern term of saying it. And I have a private practice out here. I also am involved in social media, but I am very passionate about the bottom end, or what we call the anus. So conditions regarding that, most commonly like hemorrhoids, anal fissures, infections with anal fissure, and fistula. And anal spasm is a big thing. So a lot of my practice is about relating to my patients about how they're suffering with their issues and helping them find real solutions.
Yeah, I love that so much. I think this is a topic also that is not usually talked about. I think that's why my algorithm on YouTube was like, there's one person talking about it, and it's basically you. And I just love not only the information you provide online, but also the compassion you have in your videos as well. As sensitive or even as vulnerable the topics are, it's like you can deliver them in such a not only straightforward manner, but like I can just listen to it all day long. But I'm so curious, why this specific field?
You know, I have my own butt issues. That's why. You know, I can relate, and you can always tell if the person you're talking to has ever had a butt issue. And right away. And so, you know, it's like when you have broken up with your significant other, trying to relate with the person, you know, that other person has struggled in the same way because they've been through it before. And that's how I talk to people, is like as if I would talk to myself, because I get it. And so I think that trying to relieve the emotional as well as addressing the physical and making it really hella easy to digest and understand and then apply to treat yourself, help yourself, empowering the person with information is number one. Because if they understand it, this person is going to be able to live life with confidence every day with this issue.
Yeah, I love that so much. And I guess speaking about making information more digestible, I guess colorectal health, even for the general public, some people may not know what that really means, like the colorectal region. Can you just explain for those who may not know what constitutes the region.
Actually, side point, when I was a kid, I did not know what the colon was, right? The colon is the same thing as our large intestine. And I thought the colon was talking about the women's body parts. So like colon has 2 holes. So anus is one and the vagina was second. So I thought only women had colons. No, colorectal is the lower part of our digestive system. And the rectum is attached to the colon and then the anus is at the very bottom. So we're a specialist with those body parts and doing surgery and surgical treatments of those conditions.
I guess for those who may not know, I guess what differs between the large intestine versus the small?
Yeah, mostly it's location, the way it looks in real life. And also there's a lot of other things like bacterial content, what's in the digestion, part of the digestive tract, what things look like, the waste material, what does it look like? What is the absorption of nutrients? Those are the real main differences there. So as it continues to travel along our digestive tract from our mouth to the anus, the substances are changing and exchanging.
And what's the most common or I guess prevalent health issues that affect this colorectal region?
The most common would be the ones that are not associated with cancer, not associated with other conditions like Crohn's and ulcerative colitis. They would be things like constipation, things like diverticulosis, diverticulitis, colon cancer screening, right? Those are people who are getting that test when there is no health symptom. And of course, the anus has things like hemorrhoids and anal fissures. Those are by far the most common that we see.
Yeah, and we'll talk about some of those in a bit. But I wanted to really talk more about the cancer aspect first. The WHO in 2023, they said that colorectal cancer is the 3rd most common cancer worldwide, accounting for approximately 10% of all cancer cases. And it's the 2nd leading cause of cancer-related deaths worldwide. I mean, what a statistic. I guess, what's the early warning signs that people should never ignore within the context of colorectal cancer?
Yes. To answer your question first, what should we never ignore? I think there's 4 things that I probably would tell somebody as advice. Number 1, if your food is not digesting well, what that means is after you had a meal, things are not passing through as efficiently. Like you felt like you didn't have that cramping or you felt like you have bloating, right? Those kinds of new changes, maybe you should get that checked out. Number 2, pain that doesn't seem to go away. It's recurrent, it's always coming back, and it's not just a random thing anymore. It's definitely sticking around. Number 3, blood that is mixed in with your poop. So not just painting the outside like a roller paint or a paintbrush, like candy cane type of mixed in. Number 4, family history. If you've got people in your family with colon cancer, especially when they're younger, like in their obviously below 50, but even their 50s and 60s, definitely talk to your medical provider about it. The thing I wanted to address is those numbers are super scary, like you just said. Ooh, 3rd most common, 2nd most deadly, but that's of all cancers, right? That's not in the general public. So when you think about the statistics in a different way, of all the people living in the United States, what is the incidence? What are the chances of me getting colon cancer? The answer is 4%. So 4 out of 100 will maybe develop colon cancer at some point in their life. So is that something to pull your hair about and get anxious about today and stop living life? Absolutely not.
Yeah, I love that point. I think that's what also happens when it comes to like the statistics and numbers, right? There can be a lot of fear entailed with them. But I think also it was important that you mentioned earlier is also screening as well. What does colorectal cancer screening entail?
Colorectal cancer screening is the colonoscopy, which is only one thing, but there's other tests, I think of note, which would just be Cologuard. So colonoscopy is that long tube camera that they put inside your bottom end while you're asleep to look in the inside, right? And then Cologuard is a poop test. You poop into a cup and you mail it off to a laboratory. General screening age is 45 years old, but that's if you have 0 symptoms and 0 family history, right? So 0 risk or average risk, we call it. Otherwise, if you have symptoms, then yeah, colonoscopy would probably be the best test. But at that point, it's not called a screening test anymore.
Yeah, I think also like I've had aunties and uncles who've had to do their colonoscopies and they're just chugging on that go lightly days prior. And I'm just like, I will get there.
Well, like once in a while, yeah, when you have that food poisoning thing and you poop for 10 times in a day, oh yeah. You know what I'm talking about? That's like,
I know what you're talking about.
That's pretty much like your Miralax prep right there.
There we go. I mean, the only good thing that comes out of it is the flat stomach. But other than that, please, the worst thing ever. Also, I should have made a disclaimer earlier in the episode, but a lot of our listeners listen to the podcast during the morning, during their breakfast. So for anyone stumbling upon this episode and you're having your oatmeal or parfait, I am so sorry, but this is great information. What if a single cup of tea could hold a century of stories? Tea is a 5-generation family business crafting award-winning high-mountain oolong teas in Taiwan since 1918. Grown at the highest elevations, every leaf is hand-picked, all-natural, and nurtured without additives or herbicides. The result is an array of complex flavors that evolve with each steep, honored at tasting competitions in France and Japan. From premium loose leaf and tea bags to ready-to-drink cold brew bottles, every sip is an invitation to slow down, savor, and connect. Discover tea as it's meant to be experienced. Use code FRANZ, that's FRANZ, for 10% off at daetea.co. That's DAETEA.co. Valid until February 14, 2026. Brew it hot, brew it cold. Take a moment for you. How do you know when something actually tastes good to an Asian person? When they say, it's not too sweet. And that's precisely what Wild Mannered set out to do. Founded by 2 childhood best friends who were tired of drinks that were too sweet, too artificial, and left them with worse hangovers. Wild Mannered is an Asian American founded brand focused on bridging people together with all-natural, shareable soju cocktails. With flavors like strawberry basil, cucumber lime mint, and pineapple ginger, every sip is made with real fruits and botanicals and perfectly balanced at a lighter 13% ABV. Refreshing, smooth, and never too sweet. Get 10% off your first order with code FRANZ, that's FRANZ, at drinkwildmannered.com, or hit the store locator to find them in stores across New York City. Make your next get-together a little more wild-mannered. I wanted to talk more into the specific health problems that you previously mentioned when it comes to the colorectal region. And this one, I mean, I don't know how many times I've had this, but constipation. I think also everyone has a different definition of what constipation is. Some of my friends are like, I haven't pooped in the past 6 hours. I'm constipated. I'm like, it's been 2 days for me. What are you talking about? So what actually medically is defined as constipation? Like what actually qualifies as constipation?
Ooh, good question. I think, yes, like you said, constipation is such a big word and it means so many different things. But in general, I would say, in a nutshell, inefficient transport of poop through your colon and also out your anus too. So it's not just the intestine, but also through the hole into your toilet. That whole thing. So like you said, those are all fair definitions or situations of constipation. I feel weird. I feel full because even though I haven't pooped in 6 hours, and then for you, it's like, well, I'm used to that. It's me. It's like, the time limit is weird for me. That's my constipation. I don't even feel bad. It's just, some people, it's about having a large poop that needs the anus to stretch the hole. That's the reason for their constipation, right? So it's way down in their pelvis. So there could be secondary to nerves. It could be because of the muscle contraction and the ability to push poop forward. It can be due to the pelvic nerves, muscles, and also coordination. So they all need to work together to get the poop out.
I see. Would you say that there are certain activities or like lifestyle factors or even specific food that might be a potential cause for someone to be constipated?
But yeah, I mean, all of that, every single thing. So things like daily habits. Do you sit all day for work? Yeah. I do, right? It's an occupational hazard. It's a health hazard these days. Thyroid disease, hypothyroidism, right? So hormones is a big thing. Hydration, electrolytes, right? Nutrition is a big part of it. Exercise. And so diet, yes, of course, there are foods that really dehydrate people, like carbs. Some people, it's the meats, but it varies from person to person, which why it makes constipation not just, let me just take a bunch of Miralax and just poop my brains out, right? Because that's not a good solution for everyone. And to do that once a week because you get plugged up all the time, that would be really rough for somebody to deal with.
Yeah. Is there ever a time when I guess constipation is so bad that there must be, I guess, an intervention?
Christian, have you seen these patients before? These people, you know, I'm talking about, Christian, they are freaking out. Okay. You know, they have been pushing until their eyes have popped out of their head. Some of them, they've stuck their finger in like 2 fingers deep, you know, trying to get this out. And oh my God, they're freaking out. So yes, I actually have a video where I'm straight up with people. Like I go from the simple medications to enema, sticking things in their anus, like to get water in there, to digging the poop out with their fingers. I mean, you know, when you got to go there, you got to go there.
I went there. I've been there with my
Did
patient.
you?
Well, not for me, for my patients.
Yeah, I was like, wait, was that? I didn't know about this appendectomy story. So I'm like, did you? Is that the video you watched of my?
It wasn't that bad. But I remember the very first time I had to put in a suppository or even enema for one of my patients when I was working bedside. And I was like, wow, you kind of empathize with the patient, right? They're just to the point that feels like they're in pain because they really cannot go. So I guess you mentioned also about laxatives. How about fiber supplements? Is it suggested or recommended that we take one every day, like as part of our daily vitamins or whatnot?
Yeah. Okay. So there's a question on your test that says, what's the first initial treatment for constipation? If you don't select fiber, you get the question wrong. You'll fail a test. And so fiber in general is a healthy supplement and it can cure people's constipation. But is it for everyone? And what's the right amount is the next question. So fiber has a dark side as well too. And so if you allow me, Christian, fiber has a side of it which takes up water, forms a gel, and keeps the water in the poop. It also has a bulking side as well too. And so the bulking makes the poop collected and avoids diarrhea. So it should keep things soft and in the middle. But if you have too much fiber, it can make your poops huge. It can make your poops huge volume. And so you may have to push really hard to get that really huge thing out. Other thing too is water does not hold very well in fiber. The body is thirsty. The fiber will actually lose the water to the body. And now you got a really dry brick to poop out. So experimenting with a little amount first and then titrating to what you need is the best.
Yeah. And do you have any recommendations for our audience on your best sources of fiber?
Yeah, fiber is great from your natural diet, right? Fruits and vegetables, that's the easiest way to get it. Obviously, lots of fiber fortification, right? Breads and stuff. But the other way to easily do it is just to take a fiber pill, just to take some fiber powder, because changing your diet up can be hard, you know? And it also can stress you out because, oh my God, look at this menu. There's nothing here that has enough fiber. So sometimes it's just better to just take a supplement.
I see.
But both are completely acceptable.
Yeah, I must say though, one of my friends visited China a few months ago and came back with this bottle of pills. Apparently, it's China's fiber, whatever that means. And during that time, a few months ago, I was like, I really cannot use the restroom. It's like, just take 6 of these pills and you'll be fine the next day.
Okay.
Boy. I took 6 of those pills the night before. And then the next day, I felt like I was exorcised out of demons. So whatever that was, whatever that was, I guess stick to your regular fiber supplements that you can find here.
Yeah, so I found this to be toxic for my own health too. Because when the persimmons come out in the fall, I love binging on those things, but they have so much fiber. So I had to cut them off, really, because otherwise they destroy my butthole. The hemorrhoids start bleeding and flaring. It's no good. No good.
Oh, no bueno. And I love persimmons too. Now that you mentioned it, let's talk about the big H, hemorrhoids. Oh my goodness. What exactly are hemorrhoids and why do they happen?
Good question. So hemorrhoids are blood vessels in our anus, and they are very, very sensitive people. Everybody's born with hemorrhoids. So it's, whenever people use the word, though, we mean to say we're having an issue with them, right? So we have a hemorrhoid flare. Oh, I've got hemorrhoids. And what causes them to have bad behavior is when we treat our anuses badly, which also on the other side of the coin, it's when we overuse our anus too. So the anus, for some reason with evolution, didn't quite catch up with the anus. It's such...
Yeah.
I know. I wish it could keep up with hard poop or tired poop every once in a while.
It had the one job, you know?
Yes, but that's what the main offender is stool textures and some habits like straining. So hard poop, diarrhea poop, very rough on those gentle blood vessels. They can't take a joke. And pushing obviously brings more blood down there, and all that friction and pressure makes them angry at us.
Yep. And I know. I remember... Not personally again.
Yeah. Let's just talk about me. I've got a butthole. You can talk about my butthole, Christian. Go ahead. Go ahead.
I remember that one of my friends, I won't name them, but
yeah, you can say Dr. Chung. He told me.
We were right after, I think they had like a procedure for the hemorrhoids. And I remember we had dinner that night, and I just came from a flu shot gig. So inside my bag was like some flu shots and also some gauze. And then they stood up to use the restroom, and then they stood frozen and they were looking at the chair like, oh, I think I'm bleeding into the chair. I was like, oh no.
Yeah.
Good thing I had gauze from my flu shot gig. And so all that
Savior.
all that to say is that all this hemorrhoids issues, I remember my friend being like so ashamed of it, even like prior to the surgery. So I guess this whole talk is just very sensitive, right? And I guess a lot of people want to ask, like, so how do I prevent it? How do I prevent it from flaring up? So I guess that's my question for you. Are there like lifestyle or dietary changes that we can do or we can make to help prevent flare-ups of the hemorrhoids?
Yeah, absolutely. I think the natural way is to really take care of the hemorrhoids that you have. Even if you think they're big now, if you can keep them safe, they won't get bigger and get worse. Because when they get bigger, they get more annoying and more loud with symptoms. So definitely the one requirement is to keep your poop soft. If you need to do it with fiber, if you need to do it with stool softeners like Colace or Miralax even, just do it, because sometimes figuring out the right diet can be super hard. Putting away the phone at toilet time. Oh, confession time. Here we go. Yeah, I tell people, why don't you put that phone by the door? Look at that phone. Behave yourself on the toilet. Do it right with relaxation as much as you can. Your reward is to pick up that phone and get back to your Instagram.
I feel like I could watch a whole movie sitting on the throne. So
yeah.
Oh my goodness. Yeah, that's something I have to be better about for sure. Sometimes I feel like I've watched a whole K-drama just sitting down and I'm just like, what am I doing with my life? So actually, wanted to ask you again, because you were talking about like Colace and Miralax.
Yeah.
They safe to take, I guess, for longer term if someone's poop is, I guess, is naturally like harder than usual?
Yeah, so the Colace, or it's called Docusate, Miralax, magnesium citrate, those are safe to take as much as you want for the rest of your life every single day. I have a patient who takes Miralax 6 times a day. Their constipation is so bad, right? But the great thing about those 3, it's not habit forming. You don't get tolerance, you don't get addicted, and you can stop anytime you want. Absorption into your body is also very low. So it's not like, they get absorbed into your body and like the Miralax especially, right? Cause toxicity. It just goes in your mouth, out your anus, in the garbage in the toilet.
Period. So that is the timeline. now, as opposed to, I guess, preventing the flare up of hemorrhoids, how about when it comes to when you already have flare up of the hemorrhoids? Like, what's the line between those at home creams that you can get to apply, or even like Sitz bath? And then when should someone actually see a doctor?
Yeah, really good question, because if you get one little sign of bleeding, does that mean you should rush to the doctor? I know everybody wants to, but yeah, those over-the-counter creams at your pharmacy can be really helpful, and you can see if it goes away within, I'd say, up to 2 weeks, because hemorrhoid flares take a while to calm down. So those creams can really bring some soothing calm to you, help things get better with the drainage if you have any. And then if it goes past 2 weeks, that's when I would really see a doctor for sure.
I see. It came to a point where my family was like, I can't handle it anymore. And I think they were using the creams as well. So
Yeah.
I just can't forget how they were so wary of telling me about it. I guess
Mhm.
even though I am in the medical field, it's definitely not a comfortable issue to talk about. I'm curious, how do you approach this topic when it comes to consults? I guess even though they know that you are the specialist, do you notice
Yes.
that there's still shame surrounding the conversation from the patient's point of view?
Yeah, absolutely. I mean, if you don't recognize or appreciate the emotions that are going through people's faces, I don't think you could be a good doctor in this field, to be honest with you. At least, you're not really communicating or connecting with your patients. So, what I do is really listen to their story first. Make sure that they have their say. When people describe butt stuff, it's super vague. People can't find the words to describe what they're experiencing. So that's part of the emotional aspect. Let them unload their frustrations and their feelings out. When it comes to the examination, you've got to be very careful. This is their butthole. You can't do stuff that you wouldn't do to your own butthole. So if they're in a lot of pain, you got to be careful, man. Don't shove that finger in there. Don't shove that scope or speculum in there. You've got to be informing them what's going on. And that is what's going to allow the patient to build trust in you and open up to you and really ask more questions, right? Because a lot of people that are so shocked and so like frozen and intimidated, they can't think, they can't process. So then the conversation, they'll be coming out of the room, I should have asked that and I want people to be free to talk about everything and get as much as they can out of me.
What if your routine felt less like a chore and more like a ritual? Rooted in Japan since 1946, Uka Beauty creates everyday practices that remind us beauty isn't just how you look, but how you feel. At the heart of their mission is regenerative beauty, from ingredients that restore biodiversity to refillable, circular packaging that reduces waste. Their iconic Scalp Kanzen brush transforms scalp care into full body relief, easing headaches, boosting circulation, and releasing jaw tension. And with innovative shampoos, nail oils, and serums, Uka restores balance and vitality with timeless Japanese sensibility and craftsmanship. Join the mission of turning care into impact. In collaboration with Rom Spa, you can get 15% off your first order at ukabeauty.com. That's UKAbeauty.com with the code FRANZ. That's FRANZ. One-time use only and cannot be combined with other codes. Talking about like constipation and I guess hemorrhoids, I guess these are some of the top two I would say that I see within forums online where they're asking for like
Yeah.
tips on Reddit and whatnot. I think a third one that I guess still common but not as common as the first two is anal fissures. What exactly is it? And how is it different from hemorrhoid flare-ups? I mean, honestly, just hearing the word anal fissure, it's like, I feel like I'm in pain already. But what is it exactly?
Oh, you speak from experience, Christian. I know it. When you said that, I was like, oh, you're one of us, Christian. You're one of us. Welcome to the family, bro.
So that was about my friend.
Oh, of course. This is completely confidential. No. Just between you and your friend. Okay. Yeah. First of all, the forums and like all those things, I think are awesome support group. I think everyone should join one. Totally good stuff. But hemorrhoids versus fissures, it can be very difficult to tease out the two. In general, fissures are a rip in the lining of the anus. So typically there is sharp pain, like a tearing type of pain. And it's close to the outside of the anus, and people can usually pinpoint where they feel it on their anus. Hemorrhoids don't have that usually sharp tearing pain. And sometimes if it's an internal hemorrhoid, the sensation of the feeling is actually really vague. I'll spend a little bit more time trying to tell you where it's at. But they both have bleeding, and the rest of it is really examination. Because fissures can have some bumps as well, too, because of the inflammation. There is a little bit of experience that can really help tease things out and figure things out.
I see. And what usually causes anal fissures? And why are they so painful? Asking for my friend.
Of course. Yeah. The fissures are so painful because it's a very sensitive part of our anus. The outside of our anus has so many nerve receptors, just like our lips. That's why it's so intense there. So physical trauma, big poop, hard poop, and diarrhea. Those are the three most common.
Is this something that can heal on their own? Or if not, I guess what treatments usually are there?
Yeah, they can heal on their own, and they frequently do, especially when people first start getting them, like your first few or so. As long as the episode's not severe enough, usually the pain just disappears after the first or second poop, and then you totally forget about it. But the thing I tell people is pay attention to that. Fix your habits up, because on the 20th fissure, one day, it may take longer to heal that fissure, which means you probably should see a doctor then.
Wow, 20th fissure. Is it common to go up that much? Oh my God, I'm afraid.
Yeah, and that's where you definitely should recognize that you should pay attention to this part of the body. Yeah, people can get fissures when it gets to that point, like once a week, right? Or they feel like it's opening up every week. And that's really, people can't ignore that. It's like very tough to live with a situation like that.
Yeah, and you mentioned earlier about anal fistulas. I guess what differs between the anal fistula and the anal fissure?
Yeah, anal fistula is a chronic infection around the anus. And so fissures have no infection at all. The problem with anal fistulas, where they come from, is the anal gland. Inside the anus. We don't wipe there. We don't clean there for hygiene. It's not about how clean you are, but that's the problem source. The gland gets blocked and then gets swollen and infected. And after you get a boil, if you keep getting the boil problem or drainage, that's where we're suspicious about an anal fistula.
I see. Overall, this whole conversation is just showing how sensitive the anus is.
Ugh. Yes.
Ugh, you're right. It needs to develop some thick skin because it's so sensitive. Well, I guess with all of the sensitivities and all of the issues that the anus can have, what would be your biggest health tip when it comes to the anal area?
Ooh, I think that soft poop is the one thing you can control, because it's the way you eat. That's what the biggest favor we can do to the anus, because it has really nothing more to complain about if you can give it that soft poop. My definition of soft is frozen yogurt, so it's not watery. Up to it has some shape, but it has got maybe one or two cracks. That's it. All the rest of it is like relaxing that toilet.
So
that can be very hard to control.
Is that pink berry or red mango? Like, which quality is Van Leeuwen's?
Non-chunky, totally smooth, no toppings. No. Yeah, all of those. As long as it comes out nice and smooth from the tap, that's the dream.
There we go. One of my last questions about diet, because a lot of people actually sent in questions when I said we were going to talk about all things bottom end. They're curious, what would be the ideal diet, not just when it comes to avoiding constipation or hemorrhoids or anal fissures, but just as a whole, what would you consider a colorectal healthy diet?
There's going to be a lot of controversy because the standard colorectal GI answer would be high fiber diet. But I disagree with that completely. Yeah, because if I had a high fiber diet, my butthole would be wrecked 50 times over. So, what my opinion is, number one, your diet should be something you should enjoy. So the food should be something you look forward to eating because nutrition is important. The next thing to look for is that make your poop hard or diarrhea. From there, fix that. Right? Add more fiber if it's like diarrhea, or use a stool softening agent, or maybe fiber will work for your hard poop, and modify it so that you can live life the most stress-free that you can. There's no such thing, in my opinion, as the healthy gut diet. In my opinion, diet trends are a social media salesman trend because it changes every 5 to 10 years. Like 1 year, it's like, plant-based. The next one is animal products. Keto, right? And it's like, where are all these people? How come they're switching and flopping around? No seeds. Seed oil is the enemy. No processed foods. So in my opinion, there's a lot of confusion and it stresses people out. If you're messing with people's food and what they put in their mouth, you're messing with their mental health. So first, it's got to be what you are eating with your friends. Culturally, what is it for you, etc. That's most important. It's getting the soft poop. Other than that, your anus does not care what you put in your mouth.
There we go. And I love this sentiment so much. Soft poop will be the title of this episode.
Yeah, yes. Oh, I love your puns on your titles. You got to do something good. Come on, Christian, rack that brain.
I will try to bring it up from my anus to my brain and think of something good. Well, since we're talking about food and diet, I just wanted to shout out to our listeners who have finished their breakfast while listening to this whole episode still. You deserve an autograph from Dr. Chung getting through until the end. Well, Dr. Chung, we've learned so much from constipation to hemorrhoid flares and anal fissures. And like I said earlier, it's such a sensitive topic. And, I feel like conditions and topics within this area are often sources of embarrassment and shame for many, right? And you just want to keep it hidden. I guess what would be your message to someone who is struggling with an issue in this area, but I guess they are ridden with shame from seeking help, even from a professional like you?
Oh my gosh. So I even had to prep myself before I started my YouTube channel to talk about butt stuff, social media. So it's something that's ingrained in us and we should all understand why it's so hard to approach with anybody, including a health professional. What I would say is first, find out and read as much as you can. Sometimes the internet is counterproductive, makes us more fearful and stuff and more paranoid. But at the same time, you're learning a hell of a lot. You're hearing about stuff, you're reading. So just having your vocabulary and talking to your friends is another way. So if you have someone you can confide in, talking about it is going to be another way to get more comfortable with it. And then looking at the reviews of these doctors that you're about to see, find one that you feel like you're going to be listened to. And you can start with your family doctor. I know a lot of people like to just jump to specialists, but your family doctor might be the most approachable physician, especially if you know him or her. So I would start by, it's almost like rehearsing it. And then when you get to the specialist, you may not be able to get everything out in the first doctor visit. Schedule another one. Extend that conversation. See another one for a second opinion because you thought the other doctor was a jerk, So these are all good strategies to make yourself more comfortable. But it's true, like it's intimidating because a lot of doctors don't have a lot of time, or they certainly show that. And they also don't show a lot of interest in you in that short amount of time. So it's very hard emotionally. Yeah. It's challenging.
Yeah, thank you so much for that. And I hope this episode can also be hopefully a source of, I guess, even breaking down a little bit of that wall and that shame by just, I guess, even normalizing the conversation surrounding it. And that's why I love your work so much, Dr. Chung. And I'm so honored that you came on with me today for this episode. Thank you so much.
Oh, you're so welcome. You're very welcome. Yeah, the shame is a big thing, but I'll tell you, things that have happened in my office. I mean, I've seen everything. So your provider has. I've been pooped on in my office. I've been farted on, like in my face. It's happened. So like, I feel that, if you have a good doctor, they're going to help you deal. They're going to help you get better.
Yeah, I love that so much. Thank you so much, Dr. Chung.
Thanks for having me, Christian. It was awesome talking to you.